Hong Kong has an excellent healthcare system, with both public and private hospitals offering world-class medical services to residents of the city. However, in any medical system, mistakes are likely to happen, and Hong Kong is no exception to this rule. Over the last 20 or so years, there have been numerous instances of medical blunders, with even cases of medical implements being left inside patients coming into news headlines. Any surgery or intensive healthcare treatment is likely going to be complicated. When you add the human factor into that complicated scenario, mistakes can and will happen. Hong Kong's healthcare system is one of the city's crown jewels. The doctors, nurses, and other healthcare professionals operating within the medical system are charged with the burden of taking care of the city. So how do they take care of themselves, especially in a worst-case scenario where a mistake happens? The answer is with professional indemnity medical insurance, also known as medical malpractice insurance. Professional indemnity can also be called errors and omissions insurance, or, in the case of the healthcare industry, simply malpractice insurance. It is designed to protect working professionals against the outcomes of mistakes that they may make in the routine course of their employment. For many white-collar industries, professional indemnity insurance protection is entirely optional. When it comes to mistakes, for a whole range of industries, this mistake could be something as simple as missing a word in a contract or failing to notify a customer about a problem with the service that a business is providing. But for healthcare, a mistake made by a doctor, nurse, or other medical practitioner can not only be deadly, but also has the potential to severely impact a patient for the rest of their lives, often meaning that an individual could be living with extreme pain. Under Hong Kong law, medical negligence is a form of professional negligence. It arises from an omission or an act by a medical practitioner where the treatment being offered falls outside standard medical practice and causes injury or possibly death to the patient. A large number of medical negligence claims in Hong Kong stem from the proximate cause of medical error. This can be a result of surgery or can simply be due to substandard treatment provided by the healthcare professional. Under Hong Kong law, a patient has up to 3 years after an incident or the date at which the patient became aware of the issue in which to report their claim of negligence. However, the Hong Kong Medical Council can only look at issues relating to negligence of registered doctors. This means that many soft medical providers such as beauty salons or cosmetic estheticians fall outside the framework of the Hong Kong Medical Council. As such, practitioners within soft medical fields will normally deal with errors and omissions claims on a civil basis, directly in court. Any individual providing any form of healthcare treatment should strongly consider obtaining medical negligence insurance. For some doctors, such as those operating in public or private hospitals or those registered through the Hong Kong Medical Council, medical professional indemnity insurance can be a mandatory purchase. For others, such as physiotherapists, acupuncturists, and estheticians, and beauty treatment providers, the purchase of medical errors and omissions insurance is largely an optional choice. That's us for this week. As always, we hope you have a happy and healthy weekend. Remember to like and subscribe to stay current with all our content as it comes out. And don't forget to ask CCW. We're simplifying your insurance.